We were just talking earlier about National Cabinet. They had access to this Strengthening Medicare Task Force report. Now it's being released. Health Minister Mark Butler speaking live on that right now. Let's have a listen in.
Modern healthcare, particularly in the area of modern digital health. We've got 50 urgent care centres that will be rolled out over the course of this year. And as the Prime Minister, I think, indicated in his press conference earlier, we announced 7 locations along with the Western Australian Government only a couple of days ago in that state. And in the October budget, we've already announced $160 million in additional investment to strengthen rural and regional, particularly remote, general practice as well. Now, this report and the recommendations contained in it will guide the deliberations of government between now and budget to frame particular investments needed to deliver our commitment to rebuild general practice and more broadly strengthen Medicare. The key messages from the Task Force report, though, are very clear. The first message is we need to improve access to general practice and primary care. We need to improve access after usual office hours. The former government did not allocate a single dollar to support general practice operating beyond 6 p.m. after the 30th of June. All of the after-hours programs that for many, many years have allowed general practice to offer patients care after 6 p.m. into the night all finish on the 30th of June. Their last budget before the election contained not an additional dollar, so we will obviously have to respond to that. The report also recommends better access for urgent care. It recommends the ability for GPs to be able to bill for longer consults, particularly reflecting the more complex, chronic nature of so many presentations from their patients, sometimes in the area of mental health, but we know from advocates who've talked to us over so long that particularly women dealing with family violence and a whole range of associated health issues often need to spend more time with their general practitioner than just 40 minutes. So longer consults is a clear recommendation of this report. Sustainable models of care for rural and regional Australia that have really been at the pointy end. Those communities have been at the pointy end of the crisis in general practice. As happens in so many government service areas, they experienced those shortages and those gaps in services that are now afflicting big parts of our major cities as well. And finally, in the area of access, the need to strengthen the relationship between patients and their primary care team, really strengthening and in many ways formalising that relationship is a key recommendation from the task force. The second theme is to provide more wraparound care from primary healthcare teams. The needs of patients today are very different to the needs of the 1980s. Back then, most presentations to a GP were episodic, they were relatively short, and they were to deal with a point in time or a short period in time need from the person's healthcare perspective. Now we're dealing with much more chronic disease, ongoing need, and older Australians who tend to have more than one healthcare condition. The recommendations from this report are firstly the critical need to use our health workforce more fully and to allow all of our healthcare professionals who are trained at vast community expense to operate at the full scope of their practice, to use all of their skills and all of their training rather than being restricted by outdated regulations and, frankly, too often turf wars between different groups within the healthcare system. The task force also recommends much better support for general practices and other primary care businesses to be able to employ and use nurses and allied health professionals. A very clear, perhaps the most significant recommendation from the task force report. The third message from the task force is we've got to do better on digital health in this country. We have almost countless different clinical information systems operating at state level and at Commonwealth level and in different parts of the private sector, and they generally don't talk to themselves at all, or if they do, they don't talk to themselves very well. My Health Record is now used by 23.5 million Australians. But again, the former government did not allocate a single dollar to the My Health Record system beyond the 30th of June. If we're not able to find new money to continue the My Health Record, you'll have to dust off your fax machines because the whole of the e-health system in Australia will fall over. This is just one of hundreds of measures that we've talked about that were only part funded by the former government. I had 200 measures in the health and aged care portfolio that were not fully funded through the forward estimates. And these are not pilots. These are ongoing programs that have been operating for years and in some cases even decades that were simply not properly funded by the former government. My Health Record is just one obvious example of that. But we understand that in addition to having to continue the funding for My Health Record, if genuinely it is going to be the centrepiece of a connected digital health system, we have to improve its functionality. It's currently a pretty outdated, clunky PDF format system that needs to be able to underpin a real-time, fully integrated digital health system. So we recognise that the Commonwealth has the first responsibility to move here and to upgrade the nature of the My Health Record. But we also need other health professionals to connect to it. General practitioners, pharmacies are very good at this. About 99% of them or more are connected to My Health Record and upload to it regularly. Only 11% of specialists do. Only about 20% of diagnostic imaging, so X-rays and CT scans, are uploaded to My Health Record. So time and time again, a patient goes to their doctor, talks about their conditions, and their tests are not available for the GP to look at and use as part of their diagnosis and treatment decisions. We've got to do better there. And the report also stresses how important it is to have better connections between the systems that we fund as a government at a Commonwealth level, particularly in primary care, and state hospital systems as well. And they're not currently working well enough together. Medicare is one of this country's shining stars, and it's the backbone of our healthcare system. But it's simply not delivering the sort of care that Australians need in the 2020s. Our government has no higher priority than strengthening Medicare and rebuilding general practice to ensure that Australians get the care they need when and where they need it in the community in order to take pressure off our deeply stressed hospital systems. Now, after 9 long years of cuts and neglect to Medicare, particularly that 6-year Medicare rebate freeze, I want to tell Australians, honestly, it's not going to be quick and it's not going to be easy and it's not going to be fixed in one budget. But this report sets a very clear challenge to government about how we start to turn things around in general practice and primary care more broadly. And this government is up for that challenge. Happy to take questions.
Are you ruling out a rebate?
No, I'm not ruling anything out. There was a very clear discussion in the task force about affordability. What I have said, and frankly I think a clear message from the health sector more broadly, is we can't just add more money to existing systems, particularly where those systems aren't performing against a range of indicators. Most commentators and frankly most stakeholders in the health sector are very clear that the current system does not fit the needs of Australians. An older population with a much, much higher incidence of complex chronic care. So, as I think the National Cabinet said, it's not just about more money, it's about getting the settings right, it's about getting the policy right. Those are the clear messages in this report. There needs to be reform, but clearly affordability is a major challenge. I talked about the fact that that gap fee has increased above the Medicare rebate for the first time in the history of Medicare. Affordability is a clear challenge, and of course, as a Labor government, we're considering a whole range of options about the Medicare rebate as well as all of these reforms.